I feel like it's about time that I give you a tutorial on how to use topical minoxidil for hair growth. I'm a dermatologist. I specialize in hair loss. I deal with my own hair loss. So I'm going to show you exactly how I apply minoxidil and how I explain it to my patients. And if the method you already use is working, stick with it. No need to change. But I find I get a lot of resistance when I tell people about using minoxidil because they're like, I don't want to use it every day. It makes my hair gross. And I don't find that to really be the case for me. So maybe I just have a technique that not everyone's using. When it comes to applying minoxidil, if you have thinning everywhere, of course you want to try to get the most even distribution. But for women who are dealing with female pattern hair loss, the main areas of loss are usually down the center part. We see that widening at the temples and then up here at the vertex. So rather than applying the foam into my palm and then trying to apply it with my fingertips, which I find very messy, I apply the minoxidil foam directly to my scalp. I start with my middle part here. I flip the can over and I just use very gentle pressure. I put the nozzle basically directly touching my scalp and I just do like a really slow pull down the middle like that. And then I just kind of press and rub. And that's going to be like my biggest area of where I'm applying it to because the center part is usually where people are the thinnest. Every line after that will be thinner, you will see. So once I've kind of rubbed that in, I literally just take the nozzle and I use it to part my hair like 2 inches to the side. It's not always in this exact same place. And I just pull firmly over so that my hair's not in the way so I can get it right on my scalp. And again, I just do like a little pull like that and then kind of just shoop. Push it to the back. I do this one more time on this side of my head. Again, I always kind of alternate exactly where it is every day, so I'm getting like a slightly different distribution, but I pull my hair firmly out of the way, start in the front because that's where like I have the least density, and just pull it to the back like that. Pat it in. And then I just flip my hair over and do it on the other side. Once I have those like 5 lines of foam that I've sort of pressed down into my part, I actually flip my head over and rake my hands forward and backwards. And that helps distribute it kind of up and down along the scalp. And I'm really making sure I'm pushing all the way back into this vertex area. Once my fingers go this way several times, I then crosshatch and put my fingers this way. So I flip my head back over and I go this direction to make sure that I'm really pulling it all over the place. So you can see that is all distributed now. My hair does not look like wet or sticky because we really aimed it down on the scalp, not on the hair. And then what I do is I pull my hair up into like a very high loose bun. So there's lots of looseness here so that my hair can kind of fully dry and stay off of my scalp as the minoxidil dries down. And I'll leave my hair up in a clip like this, I don't know, usually until I go to bed. And that is how I put minoxidil on every single night. I do not wash my hair every day. I probably wash it 2 to 3 times a week. And that helps maintain the style. My hair doesn't get sticky, dry, or crunchy. It works.